watching Channel 69 News, the silliest and goofiest news channel, here to give you the news. This is the Daily Goose Report, brought to you by the News Goose. News Goose here to give you news. Anthrax, ever heard of it? Bacillus anthracis, a large gram-positive rod-shaped bacterium, also known as anthrax. Its PX01 tritoxin plasmid contains a lethal factor responsible for forming a lethal toxin. That toxin disables the host macrophage's ability to form a response to pathogens. The edema factor is responsible for disabling the host immune response. The tritoxin also contains a protective antigen that acts as a binding domain, allowing for the entry of the lethal factor and edema factor into the host cells. Bacillus anthracis is also capable of forming an endospore capsule, which is very effective in protecting the bacterium from phagocytosis from the host macrophage cells. The bacteria originates from contaminated soil, plants, or water, which can be consumed by animals such as cattle, sheep, goats, and deer. Those contaminated animals can transmit the bacteria to humans and other animals, so you better watch out for herbivores. They're deadly. The bacteria, depending on how you got it in you, can cause the following diseases. Cutaneous anthrax.
Whoa. Oh no, I seem to have cut myself. Oh well, I can still take care of all my cows. My cow has died of unknown circumstances. Oh well, I don't need to put on gloves or cover up my cut. Oh no, I have a sore on my hand. My darling wife, look what I have on my hand. I don't need to go to the doctor, do I? Yes, you do. Go to the doctor's house. Hello, I'm Dr. Seth. Hello, farmer. What brings you here today? Well, doctor, I was working with my cows one day, and then I happened to cut my hand. And one of my cows done died on me. I helped get rid of it, and all was good, until a couple of days later, and I had all these blisters and swelling coming up on my hand. I showed my wife, and was this black scabbing, and she told me I better come down here right away. I believe you might have a case of cutaneous anthrax. Oh no, doctor, am I gonna die? Worry not. Only 80% of patients die if left untreated due to secondary infections. However, you are here, and I will treat you. How are you going to treat me, Doc? With antibiotics? Yes, farmer. We'll use antibiotics to treat that. We're either going to use ciprofloxacin, doxycycline, amoxicillin, or penicillin. Doctor, what caused this? Could my cows be sick? Yes, farmer. You should get them tested for a bacteria known as Bacillus anthracis. Of course, Doc. I'll get to that right away. Is there any way to prevent them from getting Bacillus anthracis in the future? Yes, Mr. Farmer. There are vaccines developed for animal use. They're live attenuated and used annually on your animals. Well, thank you, doctor. I'll be careful, make sure this don't happen again.
Inhalation anthrax.
I'm excited for another day at the mail office. Let's see what I have to do today. Oh, what's this? An unlabeled letter? I better open it and see what's up. Oh, wow! Boss, you better come in here. Who's shouting my name? Everybody knows it's my nap time. Well, boss, there's an accident. I opened this letter and it was full of white powder and it got all over. What should I do? Somebody call the biohazard team. We've had an anthrax incident. Uh-oh. Does that mean that I inhaled anthrax? You better go to the doctor right away. Hello, I'm Dr. Seth. Well, it's a good thing you came in now, because inhalation anthrax is one of the most deadly forms of anthrax. Oh no, doctor, am I gonna die? I can't say for sure, mail worker. You see, the incubation period of inhalation anthrax, it can be from 1 to 7 days, or even up to 2 months. Well then, what should we do, doctor? In cases of inhalation anthrax, we always recommend a 60-day course of prophylaxis. I would recommend using doxycycline. If you show any of the signs or symptoms, we'll have to get into a more intense course of antibiotics. Signs and symptoms? What are the signs and symptoms of inhalation anthrax? If you start experiencing any fever, chills, chest pain, shortness of breath, cough, confusion or dizziness, fatigue, nausea, vomiting, or stomach pain, body aches, and headaches, let us know right away. Is there any sort of vaccines that I can take? Yes, male person, there is a vaccine. And because you're considered a worker at risk of anthrax exposure, you can have it. The vaccine used in the U.S. are a form of subunit vaccines. You'll need to be administered in a 6-dose series over 18 months. But that's after we know for sure you don't have inhalation anthrax currently.
Gastrointestinal anthrax.
Oh wow, I'm really excited to go deer hunt in this new area I've never been. I'm so hungry. Oh, look, it's a dead deer. Oh my god, I can just grab that and cook that up. Look at this delicious meal. I'm not feeling too good. I think I should go to the doctor. I'm Dr. Seth. What seems to be the problem? I haven't been feeling too hot. Well, I've been feeling too hot and just so cold. Oh my god, everything's been swelling. My neck, my stomach. I can't swallow right anymore. It just hurts so much. And I've been having some real runny poos. Oh god, and vomiting and everything. And oh no, that is not good. I'm sorry about that, doctor. I've also been fainting a lot now. What's wrong with me, doctor? Am I gonna die? We must take your blood and figure out what is wrong with you. I don't know how this could have happened, Doc. All I was doing is hunting like normal. I mean, I found this deer that was already dead, and I figured, why not take it and eat it up? Ah, I see. Well, I have your blood results right here. You have gastrointestinal anthrax. Oh no, doctor. What do we do now? I recommend a course of oral antibiotics. Is there anything I can do to prevent this in the future? I would recommend that when you're visiting anthrax-endemic countries, you should avoid direct or indirect contact with animal carcasses and avoid eating meat from contaminated animals. You got it, Doc. I won't make this mistake again.
and injection anthrax. Welcome back to the Goose Report. Watch out! Bacillus anthracis found in heroin? Cases of the newly discovered injection anthrax has been seen in Northern European injection drug users and has been linked to certain heroin strands, with no cases being reported in the US. This form of anthrax spreads rapidly through the body and has been difficult to identify and treat. Some possible signs and symptoms that may be experienced due to injection anthrax is blisters and black scabbing forming around the site of injection, abscesses forming in the muscles near the site of injection, and possibly fever. Thanks for watching Channel 69 News, the silliest and goofiest news channel. This has been your Daily Goose Report. Goose, signing out.